Hi, everybody. Welcome to Remaking Medicine. My name is Emily F. Peters, and I'm excited to be back with you today, yet again, talking about the intersection of art and medicine. And specifically, right now, we're on a theme of physicians and medical students who are artists, and what does that kind of change and bring into the world? So I'm really excited that we have a guest today who's going to join us just in a second to talk about her art. Here she is, Yeonsoo Sarah Lee. Welcome. How are you today?
I'm doing well. Thanks for having me.
Yeah, wonderful. So I'm so excited. We got to connect once before, and I got your book, and I was looking for it. My daughter has now taken your children's book and is hidden it somewhere in the house. So I apologize that I don't have my copy with me right now.
Nice.
But why don't you introduce yourself and just tell us a little bit about your work at the intersection of art and medicine?
Yeah, absolutely. So I'm a fourth year medical student at Mayo Clinic Alex School of Medicine. I'm graduating actually just in a couple of days. I know it's crazy.
Congratulations.
So then soon I'll be a urology resident. I'll be staying at the Mayo Clinic in Florida, beginning residency in urology, which is an underrated field and a field I love to talk about, but that's for another time. I also will graduate with my distinction in the Applied Medical and Health Humanities, which is the inaugural year that it's been present at Mayo Clinic. And basically, it's just a community of really like-minded folks who love doing art and recognize that elements of humanity are important to recognize in our providers as well as our patients. I started my art again in medical school, had always done art growing up. But really just kind of used it as a tool to de-stress with COVID and everything going on. Started doing art outdoors, loved spending time outdoors, doing watercolors outdoors, and then translated that to the classroom when I was studying anatomy. And it's just kind of taken off from there. I was like, oh, it's very cool that I can incorporate art into medicine and actually part of my career. So I've been able to do some medical illustrations since then, some medical journal covers. My children's book that you mentioned, I have a couple copies downstairs if you want me to run down, but I'm also happy to just chat about it too.
Wonderful. Yeah. And I think one of the things we talked about earlier is that, for even just like the one generation or two generations ahead of you, this idea of being in the humanities, of being an artist and a med student is relatively totally new in modern times. Like that, there have been for decades this pressure to only be a med student, only to be like a scientist and a scholar in that way. And from what it sounds like with your experience, this is like kind of not a big deal to be an artist. And that's like, it seems like just like a real huge change in medical education. Have you
Yeah.
seen it sounds like there's a lot of other artists that you've been studying with.
Oh, absolutely. And I think I know we talked about this. Um, I think in the older generations, it was a thought to be really professional to have that image of being a provider, of being a healer. And then outside of that, it kind of almost detracted from the image of you being a professional. But I think one thing I really loved about being involved in the medical humanities is not only is the work I do, it's not only just work I do, it's celebrated within like my institution. People are like, wow, this is so cool. This is an aspect of you outside of medicine. And I think people are starting to realize that that makes people feel really valued. And that's important for us to discuss in our patients. So I think it's just as important to discuss with our colleagues.
And I just recently went to an event. I was talking to several people involved in medical education, and they were saying, that for nurses, their first patient is a patient, right? They're changing the sheets for somebody, and it's like a real person. And for med students, your first patient is often, a corpse that you're dissecting in an anatomy lab. And how that kind of starts you at a place of like almost dehumanizing patients from the beginning. But actually, I think even before the anatomy lab, your first patient is the illustrations and the drawings, right, that you're studying. And it almost feels like art is a an even earlier pathway in. Did you love that? Was that kind of what inspired you to get back into art? Was you were like encountering those, illustrations of anatomical drawings and scientific drawings?
Yeah, actually, I that's a wonderful perspective. I had never
Mhm.
thought about it that way because one thing our educators did as part of our anatomy course was introducing the cadavers we learned from. They called them donors, and we discussed
Mhm.
aspects of their lives before they donated their bodies to science and medicine. We had this ceremony, and I now recognize how much effort and thought they put into making sure that we thought of these donors or first patients as real people with
As
real
people,
lives.
which that's totally new, right? That's fairly
Yeah,
new that people are doing that and recognizing that these were people, right?
totally. Yeah,
Mhm.
and I think for me, I didn't really think of the anatomy drawings, and obviously everyone loves Netter's work, and that's
Mhm.
kind of like the staple for studying anatomy. But it was just I was trying to find the most efficient way to study.
Mm.
I was a post-bac student, and what that means is I took some time in between undergraduate and medical school because I didn't want to be a doctor when I was in college.
Mhm.
And so I'd been a little bit removed from studying and studying techniques. And there are a lot of different ways you can study in medical school. And so I think for me, drawing things out was something I did in college. And so I just kind of applied that to medical school. And it was really, really useful for anatomy because, as you can imagine, it's like thinking about the visual relationships of different locations of organs or where arteries branch off. And
Mhm.
that's always easier for me to see and to draw out and to touch than it is for me to write out like, oh, this artery branches off lower than the other.
Right.
So yeah.
And that's such a a huge part of medical education, right?
Really.
Of drawing and understanding the body through that way of study, right? Have you gone back? Do you have a favorite historical medical artist in history? I mean, there's obviously some huge names.
Ah, gosh. I think I should be better versed, but I think Netter is kind of unbeatable.
Mhm.
He just has such a comprehensive collection. I have one of the thick Netter atlases downstairs just to look at to refresh my own memory before surgery.
Mhm.
So I think his work is kind of like timeless.
Mhm.
Yeah.
That's wonderful.
Yeah.
And then one of the things that seems like part of your story is not just doing art on your own, but also like collaboration,
Oh,
right?
yeah.
And collaborators. So tell me more about like that process for you.
I think that's one of my favorite things about doing art is not only getting to talk to people, like we said, who are similarly like-minded, but
Mhm.
it's such a good way to learn from each other.
Mhm.
Like this morning, I just had an article released with another medical student going into urology that we collaborated on. It was a narrative medicine piece with an illustration. And we just went back and forth being like, oh, this piece was on medical education and how important it is to have mentorship, even in the
Mhm.
smallest procedures like placing a Foley catheter in urology.
Mhm.
We drew out the anatomy of a Foley trib and we went back and forth being like, I don't know if this is like what we'd like to highlight here. Oh, but I want to make sure that this illustration emphasizes this talking point in the essay. Um, and so there's a lot of back and forth and highlighting of perspectives that I wouldn't have thought of on my own. And then just kind of on another side, I'm working on a really big illustration project with a surgeon who is um, kind of a cutting edge researcher, someone I really respect, and so has knowledge way above my level of training. And
Mhm.
getting to work with him, I get to get a little bit of a peek into the surgeries that he performs, the instruments that he uses, the
Mhm.
steps of the procedure, and so it's frankly something that's way above my head right now. But I'm
Mhm.
able to learn how to depict it, which gives me a better understanding of what he's researching.
Yeah. And those kinds of collaborations or that ability to collaborate with people is something they don't teach you necessarily in med school,
Yeah.
right? Have you been getting a lot of advice as you prepare for residency, of like how to try to continue your art at the next stage in your training? Because you're going from a phase, that is intense, but that has a little bit more space, right? For other things where residency, kicks it up a gear.
Yeah, I think it's while we have mentioned that art and the medical humanities are getting to be more well known in medicine,
Mhm.
I still think that careers that combine the two are relatively new.
Mhm.
Like I actually was talking to Dr. Laura Tafe, who I know you've
Yeah.
highlighted, and we've talked about her work. And she was saying that it's funny because she finds that she's navigating how to integrate her art into her life and into her practice, and she's much more senior in terms of
Uh-huh.
medicine than I am. And so I imagine that I'm going to have my own like bushwhacking to do to figure out
Yeah.
what that looks like in residency.
Right. But that process of also drawing for yourself and drawing for your colleagues, but also drawing for your patients is going to become
Right.
really important, right?
Yeah, absolutely. Mhm.
That's so great. And have you been excited to explore any different kinds of mediums or different, you're really focused on the drawing, but writing or other types of things? Like, are you, as you enter kind of this next phase, are you interested to maybe think about different kinds of materials coming with you?
Totally. I think one thing that I've learned about myself and doing art in medicine is that it's really okay to be really bad when it and that not everything I start using, I have to become like the world's expert in or incredibly talented at. But can use it as a tool just to reflect. I started writing poetry, probably not the best poetry in the world, but something that I think captured some really meaningful moments to me. And
Mhm.
um, I hope to continue to explore different venues, narrative medicine, different media, because who's like it, I think everyone wants to just try something new, right?
Mhm.
And then in kind of the scientific realm, there's always more incorporation that could work, especially with technology and 3D printing and um, digital illustration. So I always feel like there's so much to learn, and that's
Mhm.
exciting. I don't know if it'll become like a permanent part of my career, but
Yeah. It's fun to get to talk to you at this point of transition, right? Of like you're wrapping up this phase. And you mentioned like you didn't always want to be a doctor. Tell us more a little bit about your process like into medical school now as you're ready to leave it, and kind of close this chapter. How did you decide to pursue this after all?
yeah, I think one thing that I've really loved in reflection of my journey to medicine is how unexpected a lot of these twists and turns have been. I was a fieldwork ecologist in college, studied ecology and evolutionary biology. I like to joke and tell people that my senior thesis involved a lot of fishing because it did. And I thought I wanted to become just a fieldwork biologist, collect samples, design my own questions and research, and then run the tests, write the analyses, share these results, add my little bit of information
Mhm.
to scientific literature. And I think you can probably still tell that I love doing research. I think it's very similar to doing art in a lot of ways. You figure out
Mm.
new things and um, kind of get to be part of a community. And when I graduated from college, I got a scholarship to do that kind of work in Brazil for a year doing disease ecology work on a disease called leptospirosis with a professor named Dr. Albert Koh at the Yale School of Medicine. And he gave me some really good advice when I got there. I told him that wow, it's crazy to be doing this environmental research, collecting samples of soil and water and rats. My mom did not love that. But it's really hard to see patients suffering from manifestations of disease and have no idea what to do.
Yeah.
And he was like, well, here's the thing, an MD, you can still do research and you can learn how to treat people. And I thought, well, that isn't that kind of like the best of both worlds. But the problem is I would have to go back to school because I didn't do my pre-med recs. And but I did. I went back to school, took my night classes while I worked a job and learned a lot at that daytime job. But yeah, lots of twists and turns.
Yeah, but I think it's some of my favorite physicians are people who didn't go directly straight into it, right? Who came to it
Yeah.
feeling really thoughtful about what you're getting into, because it is, especially this next phase for you, it's going to be, it's a lot of work, right, to do this. And it's really good to know why you are getting into this profession. How did you come to choose urology?
Yeah, I mean, I think about that because when entering medical school, I thought I wanted to be an infectious disease doctor based off my
Mhm.
previous work, or a internal medicine women's health doctor because my job before medical school was working with the Division of Women's Health up at a hospital in Boston, and I loved both of those things and the people I worked with.
Mhm.
Then I came into medical school, and I think um, it's funny because we have this idea of what we think we want to do, and then once you get to a place of learning, you do exactly that. You just learn about a whole bunch of stuff that you might like even more or prioritize
Mhm.
even more. My first couple of times in an operating room, I was like, how special is it that you can do surgery to help care for someone? And for someone as tactile and as visual as I am, I think that really resonated with me.
Mhm.
And I was like, that would be amazing. And of course, this could be a whole other podcast about why being a woman in surgery is kind of terrifying in some ways.
Yeah.
But especially being a woman in urology, which the latest census from the American Urologic Association says that 12% of practicing urologists are women, which is actually an increase from 8% from there.
Wow.
Um,
Yeah.
yeah, so I think after that, it just kind of fell into place where I was like, I want to do surgery. I still want to be in a field where I can advocate for my patients, like I had learned how to in infectious disease and women's health work. Oh, it's kind of crazy that there's such an unmet need for urologic care for women.
Mm.
And it's not a field that everyone knows a ton about. So there are actually like unmet needs for patients from underserved communities as well. Plus, I think, I mean, and now I'm getting a little bit into the weeds. Urology is a field that not a lot of people know about, but the more I learned, I was like, there's a massive amount of flexibility in this practice. You can
Mhm.
do big surgical cases for patients with cancer, or help promote quality of life with patients who are suffering from fertility issues, because 50% of the problem is also coming from male fertility. But I think
Mhm.
we'll focus on female. And um, there's lasers you can use to treat kidney stones. And there's just so much variety in the field.
Mm. Mhm.
It keeps all the doors open. Thanks for coming
Yeah.
to
I
talk.
love I love the niche. No, it's
Yeah.
incredible. Like you said, it's a really it's one of those specialties where there's so much variability in what you can do, right? And really be thinking about, the surgical side or the clinical side or the research side or the innovation side. Yeah. Was that first time that you went into the surgery that like changed your life to see that in action?
Yeah, it did. And actually, I didn't find out about urology until about halfway through medical school,
Mhm.
because nobody in my family had experienced any kind of urology exposure. Nobody was in medicine. And so we didn't talk about it. And it's kind of a niche field.
Mhm.
Yeah. The
Yeah.
first few times I was like, okay, I'm gonna look into general surgery and cardiothoracic surgery or orthopedic
Mhm.
surgery. And I was actually coincidentally matched to urology for required rotation, which is when I found out about
When
it.
it happened. That's amazing. So tell me some of the things that inspire you, like books or other artists or things as you head, off into this next chapter in your training.
I mean, I think one thing I've loved about being so connected, like we're getting to do this on LinkedIn.
Mhm.
I've met some of my biggest supporters and inspirations on through the internet. Is just how much you can learn from other folks. For example, I learned about the Covenant of Water and Cutting for
Mhm.
Stone by Dr. Abram Verghese through the internet. And I think reading some of his work, we talked a little bit about narrative medicine and poetry.
Mhm.
Um, it's inspiring to see how many elements of life he's been able to incorporate with his vast knowledge of medicine too.
Mm.
So books like those I love listening, or I love reading to or listening to as audiobooks.
Mhm.
I think similar other elements of exposure to different fields that I don't think about. The Body Keeps a Score by Dr.
Mhm.
Bessel van der Kolk just gives more insight into maybe treating patients through trauma-informed
Mhm.
care.
Mhm.
I just love listening to how other people practice their art
Yeah.
of healthcare.
Yeah, and that is really like an artist's approach and also medical approaches that you learn by seeing other people's techniques and seeing if you can replicate that technique. Like, that's a really important intersection between the two fields. We have just like 10 more minutes left, and I would love to hear maybe advice for med students coming in, right? Who are now graduating and going into medical school. It sounds like you had this incredible experience being in an environment that really supported medical humanities and encouraged that. Maybe talk a little bit more about that program. And then also, what if you find yourself in a situation that is not like that? What would be your advice for people?
Yeah. No, I recognize continually how lucky I am to have been at a place of training that was so supportive.
Mm,
I think first and foremost, I'm involved in a lot of mentorship stuff, and a lot of the same advice I give is pretty similar to what I know other people have given me, is don't lose yourself.
mhm,
I
mhm.
think medical school in a lot of ways, like other high level, high intensity, competitive areas, you feel like there are all these check boxes you need to meet, like to do really well on this, this, and this, and also do research, like build an orphanage, publish 3 books, like run triathlons.
Mhm.
And I think in that process, the the competition, you have to realize that the competition is going to be impossible because there's always going to be someone who's more impressive than you. And I don't say this in like a demeaning way. Um,
Yeah.
if you focus on that, you lose elements of who you are. I was talking to one of my mentees, and she was like, "Okay, but do you think I should do research on this, this, and this?" And I was like, "Hey, wait, back it up." What I talked about most during my interviews for residency and with other people is what I like to do, like
Yeah,
art. Um,
yeah.
and I know she has really strong interests in advocacy work, like just be yourself
Mhm,
genuinely. And of course, you have to do like the prerequisites, but
mhm.
don't lose yourself in the process, because I think that's what will make you stand out,
Yeah,
not only as an applicant, but just it'll be like the most genuine way you can live your life.
yeah. And
Yeah.
were there clubs that you joined in addition to kind of the more curriculum-driven thing? Like, is that how you were collaborating and finding other artists too?
Yeah, and a lot of that wasn't institutional because
Mhm.
before that distinction track started, I just ended up doing illustrations for some of my friends in different areas, making class T-shirts.
Mm, mhm.
Yeah, for multiple classes actually. It just art is such a community building area that I was able to find people with whom I could like make
Yeah.
t-shirts, make illustrations to share as part of like a social media campaign or as a logo or something.
Mhm.
Um, and I think that's, to answer your second question, something that people can do if they don't have an existing program, because I'm pretty lucky. But also, I think I was there when that program was developing, so it's not
Mhm.
like I had like a storied history.
Mhm.
But you can be part of that group that pushes to create that, and it doesn't have to be anything big. You can just show how powerful art is.
Mhm.
Together how powerful it is in communicating. Part
Mhm.
of the reason people know me as an artist, which is funny because I didn't ever really do art before med school, is because I shared my study guides with people.
Mhm.
So I think little ways through that, never be afraid to cold call people. Some of my
Mhm.
coolest projects have been with cold calling people and being like, "Hey, I have this piece. What would you think about using this?" Or
Yeah.
so I think it's not always going to be evident, And
Mhm.
don't be afraid to fail.
Yeah, which is hard because medicine is a field that has got a lot of perfectionism in it, right? And people
Totally.
wanting to not just only be perfect, but to be perfect within the boundaries of what, a perfect medical student looks like, or a perfect,
Right.
um,
Yeah.
like it's very deep, right?
I'm so guilty of that. And I think art is a good way to remember, like, hey, you can suck and still be an awesome person at something. Or you
Right.
can suck at something and still be an awesome person.
Right. And that's hard. I mean, even, I just went to this event with all these like top Ivy League physicians who are, assistant deans of things and have like committee chairs, and they still feel that same feeling of being, afraid to try to like put yourself out there, right?
Right.
To share, to try to do something that's outside of your expertise, like to try to do something with art, or to try to, form a club, right? Like that's a skill that a lot of people don't necessarily have. And it's something that people are really eager for, right? Like I'm sure when you started sharing your study guides, people were like so happy to have that.
Yeah, I mean, I don't want to toot my own horn, but I think the reason I did so much art was because I found it such an effective way to study, and compiling
Mhm.
all that information is different from reading from a textbook.
Mm.
It's different from
Mhm.
watching a video or podcast. That's what the best study guides kind of look like.
Yeah. No, that's such a great theme, I think, for our whole conversation is like art as study, right? And that like studying is such a huge part of medicine, not only in your training, but just as you continue to practice, and that idea of being a student, right? And really studying things. And the art gives you like a whole new toolkit of how you study and how you really pay attention to things and treat them as precious.
Yeah,
Um, that often like as you're practicing as a full-time physician, right, you're entering your chart notes in Epic, and it can feel really distanced from that study in your day-to-day practice, where I think if you're able to carve out some time for some kind of art, if that's writing or illustrations or drawing or something that gives you, kind of returns you back maybe to the type of medicine that we all love and that we want to have be the future, right, for our
yeah.
practice in the
I
future.
love what you said. It's like
Yeah.
you're reminded of how precious this is, how precious of
Mhm.
an opportunity, how big of a privilege it is. Yeah.
Mhm. That's wonderful. So the last question that I always ask is to tell me some version of a medical or healthcare like utopia might be for you. And, if you wanted to put yours in medical school or maybe like looking ahead to residency, but like tell me, what would be like that dream state that you'd love to see?
Yeah, maybe I'm already just like a deep optimist. But I think I'm really excited about residency and have been so grateful about being in medical school because I can see so much change happening. And I
Mm.
don't know what that final product looks like, but the direction, like we talked about, nobody kind of makes fun of me for doing art and medicine, but I do know that there are probably people who felt like they had to hide other hobbies just
Yeah.
generations ago. And similarly, I met a physician who um, wanted to be a urologist 20 years ago and was really made fun of on the interview trail because for being a woman. And so I think I just feel so grateful. We're not in a utopia now, as you know.
Yeah.
Yeah, as you
Yeah.
know.
But it's so great. I mean, there's signs of life, right? There's
Yeah,
signs
there's
of
signs of
hope, and
life.
that's not nothing. That's huge.
Yeah, and I'm like, I don't know what that life looks like, but we're getting there.
Yeah.
So, I mean, utopia, I could say like so many things about like access to care, better access,
Mhm. Mhm.
higher quality, which means like more innovation and more research and more study and more quality improvement, big buzzword, and
Mhm.
technology and thinking about the communities that you're serving and the community that we're building in healthcare. But I think just having these conversations is really important, and I feel pretty cautiously optimistic that things will just kind of keep on getting better.
Oh, I love it. I mean, just talking with you, it just makes me so grateful for the change that is happening. Because I know physicians my age who talk about sort of like coming out of the closet as a musician, right? Or like
Yeah.
coming out of the closet and being like a photographer and feeling really scared, or like that they had to be really brave to do that. And the fact that this is part of your education and part of your system, and also sharing, that process with your anatomy lab, and like recognizing that this person is still a person, even though they are, there on a table to be dissected and to be learned from. That's just such a massive culture change. And I think, like you said, let's not take that for granted. That's huge. And it shows us that if those things can change, other things can change, right?
Yeah, stuff that I probably don't even know about, So
Yeah.
I think it's just like chipping away at that block of marble.
Yes,
Yeah.
exactly.
Then the David will emerge.
Right. And making it better, leaving it better for the people who are coming behind you, right? There's a
Absolutely.
whole new generation of people who will be starting med school in the fall, and hopefully you left it better than you found it, right?
Yeah, totally.
Oh, that's so wonderful.
Yeah, I think I love working with people who are already just like a couple years behind me, because everyone's like, oh, well, it's not how it used to be. But I think I recognize that there's so much new energy and so much to learn from generations that come after me too. So
Yeah, that's so wonderful. Well, where can people get your book? Give us the shout out. Where can we follow you?
yeah, totally. Well, my book is on Amazon. It's called The ABCs of Anatomy. So you can just kind of type that in, it'll be there. And in terms of socials, I'm pretty much the same thing under everything. It's YSaraLee on Twitter, X, or ysaralee_art on Instagram, which is where I kind of have a living portfolio of my art.
Wonderful. Well, I can't wait to follow you and your next steps on Instagram, and to see, how you take this now out into clinical practice, into this next, just like wonderful, but also challenging phase of training that you're going into. And yeah, thank you so much for being with me and talking about all this.
Yeah, thanks for your time. And I look forward to continuing to see how you highlight other people in our community.
Oh, wonderful. Thank you so much. And congratulations on your graduation.
Thank you. Yeah, you're fine.
Wonderful. All right. Thank you so much. We will be following you very closely. Bye.